The Omicron variant of COVID-19 has swept across Ontario as no previous strain has. It's truly put pressure on everyone, including public health units who've already been overworked for going on 2 years now. Here to tell us how the regions are confronting the new variant. In Sudbury, Ontario, Dr. Penny Sutcliffe, Medical Officer of Health and Chief Executive Officer for Public Health Sudbury and Districts. In Thorold, Ontario, near St. Catharines, Dr. Mustafa Hirji, Acting Medical Officer of Health and Commissioner for Niagara Region Public Health and Emergency Services. And in the provincial capital, Dr. Lawrence Lowe, Medical Officer of Health for Peel Region. Hi to all of you.
Hello.
Hello.
Thank you so much for making time for us. I know you're incredibly busy, and to have the three of you on the show, it's such an honor for us. Dr. Sutcliffe, I wanted to start with you, and I want to ask this question to all three of you. The province returned to a modified version of stage 2 earlier this week. What impact do you hope this will have in terms of stopping the spread of Omicron? Dr. Sutcliffe.
Well, actually in our area, we started experiencing a surge with the Delta variant in early November. So in fact, we look to the measures similar to a modified stage 2 in early December. And with the Delta variant, we were seeing a decrease in cases. So that was very encouraging. Then, of course, Omicron entered into our community in Sudbury, Manitoulin districts, and we've seen quite a surge. My hope, however, is that given that our population is used to these measures now from early December, that we will continue with them, decreasing contacts, giving us an opportunity to really get more booster doses in people's arms and protect, in particular, the most vulnerable. So decreasing contacts, really making sure that we dig deep again, and everybody's very tired, as I'm sure all listeners are aware and feeling the same way, but knowing that this is an acute situation that requires extraordinary measures and really should help us to do our full extent possible to decrease the contacts and further protect people.
And Dr. Hirji?
Yeah, as Dr. Sutcliffe says, we're dealing with a very difficult time right now with the Omicron variant. And just the nature of this variant is it spreads so easily, so quickly, that unfortunately I don't think these measures are going to stop the spread the way previous lockdowns might have. What this is going to do, though, is it's going to slow down the spread and buy us more time to get those booster doses out to people and really put in place some additional measures to keep essential places like schools open. And that's really what the name of the game is. But coupled with those measures, I think it's really important that we all personally do the things that we can do to make sure we stay safe and limit the spread as well, which is really limiting our social contacts, staying home as much as possible, making sure we're wearing those masks really diligently, keeping physical distance from others. And if we do that, we'll make sure we keep ourselves safe until we can get our booster doses, and we'll slow the spread in the community as a whole, making sure everybody else stays safe until they can also get their booster doses.
And Dr. Lowe?
The reality is my colleagues have highlighted the fact that we are now in a different phase of the pandemic response. And this is really a little bit of a transition to some degree because Omicron has required that. Omicron has spread further and faster than any variant that we've seen. And the reality is that some of the other measures that we used previously are not going to necessarily have the same overall impacts as we did in the past. So it really behooves us now to start shifting our approach to making sure that we are protecting our highest risk settings, hospitals, long-term care, congregate living settings, et cetera, but also really that individuals take the steps that they can during this surge to make sure that they're staying safe. And that means things like getting vaccinated with 2 doses. That means getting a booster if you're older. That means getting your kids 5 to 11 vaccinated so that when school reopens, as they should, hopefully in short order, they can also have additional peace of mind, and also making sure at least during the storm, you're continuing to limit contacts, wear your mask when you're out and about in public, and really keeping yourself and your family and your community safe.
You've all mentioned different phases of this pandemic. Dr. Sutcliffe mentioned that people are really tired. And Dr. Hirji, you mentioned that these measures that we have right now in this modified stage 2 are not going to be able to, achieve what could have been achieved if this was the Delta variant. Dr. Hirji, should the province have brought in these restrictions and much sooner?
I think they probably should have. These Ontario Science Table called for a circuit breaker measures really for December 15th. And unfortunately, it was delayed, which I think has put us behind the 8 ball a little bit at this point. Past is past. We have to deal with the situation we're in right now. It's good we finally have these measures in place, which are going to start to help slow the spread and make sure that we don't see huge surges that overwhelm our systems in our hospitals. We need to make sure, as we were saying earlier, though, now we use this time to make sure we get those booster doses, we get our kids vaccinated, and we take those steps that we can take in our personal lives to make sure we stay safe until we're past this Omicron wave and starting to enter that next phase of this pandemic, which will hopefully be very close to the end of it.
And Dr. Sutcliffe, part of your many different responsibilities in your position is communicating this information to people. We just finished the holidays. People are, I think, we expected a little different start to 2022. How do you approach communicating all these different changes when some of the pieces, you don't really know where they're going to end up landing?
I think that's a really good question. So yes, I'm the medical officer of health and CEO for my region, but I also live in my region and experience all the same frustrations that all of our citizens do. So certainly making sure that we're conveying the empathy and the understanding of how difficult this is and the sacrifices that everybody has had to make. For sure, our healthcare workers, our public health staff, but everyday citizens, business owners, parents, etc. So making sure that we are trying to communicate as transparently as possible. This is not news that anybody wanted to hear before the holidays or after the holidays with regards to the additional shutdown measures, as well as the schools transitioning to virtual learning. Nobody wanted this, but this is what we are living with right now. So making sure also that people are aware of what it is that they can do. So not only telling people what they can't do right now, but what they can do. So be that virtual gatherings, be that ways to keep your family safe, all the measures that have been mentioned by my colleagues, vaccination obviously very critical. And for people really to understand that this is about all of us individually, but also about all of us collectively, so that we are, the concept of protecting our healthcare system is actually made personal, that we understand that should I or my neighbor need to visit the emergency department, that our staff and the hospitals are there for us. So really understanding the sacrifices that we are making, but also seeing the light at the end of the tunnel, which I think our colleagues are also communicating with regards to the transition phase that we dearly hope that we're in right now and transitioning to brighter days ahead.
And Dr. Lowe, I saw you nodding your head.
Yeah, I think the really important thing for folks to remember is that we are in a different situation and context. I've heard a lot of folks say, well, this feels like March 2020 over again. Nothing could be further from the truth. We have a different context with a highly vaccinated population. We also have a totally different variant that is extremely transmissible, that is really changing the way that we approach and the way that we are tackling this pandemic response. So I encourage everyone, really, there is a lot of hope with our current situation as well, because there are things we can do to see ourselves safely through to the other side. Getting vaccinated with 2 doses if you haven't been vaccinated, getting your kids vaccinated, getting vaccinated with 3, making sure, like a snowstorm coming out there, we know that if you can just stay off the roads and keep it open for those who essentially need to be out there, for first responders, etc., that'll help to keep everybody safe. Thinking about our frontline workers and people that can't work from home, and certainly our healthcare workers, and the impacts that reducing contacts will have, where our hospitals just really need to get over the hump through this difficult time until we're on the other side, where this is essentially burned through, and ensuring that we are all taking steps not just to protect ourselves, but to protect the highest risk people in our community.
And Dr. Hirji, Dr. Lowe mentioned March 2020, and a lot of us feel like as if we're back in March 2020 with having to learn online, different places being closed. But throughout this pandemic, one of the messages that we've been getting, stay at home, get vaccinated, because we don't want to overwhelm our hospital system. How bad is it in terms of hospitalizations and deaths right now, Dr. Hirji?
Yeah, so, as Dr. Lowe was stating, there's some elements that maybe are similar to March 2020. Obviously, the surge of cases, obviously the importance of us breaking up our social contacts. But you also just mentioned vaccination, and we did not have vaccines in March of 2020. We also have new medications, including some perhaps new ones that may be very soon approved. That's going to be a real game changer. And, when I look at our community and, back in March of 2020, we saw long-term care homes very badly hit. We saw lots of illness and tragically many deaths there. And one of the things that I'm seeing here is that over the last 2 years, because we've learned so much about COVID-19 and how to control it, we're sadly seeing outbreaks in long-term care homes, but at least in my region, they're much smaller, and we're not seeing people dying in those outbreaks. And that's thanks, I think, principally to that vaccine is really protecting people, but also we learned so much about how to protect these people and how to make sure things are safe. And I think those same lessons then factor into what we're all going to do in society as a whole. We've learned all kinds of things about how to keep ourselves safer. Yes, keeping 2 meters distance, even more distance as possible is important, but we know about how masks are important. Wearing a well-fitting mask that properly covers the face, nose, mouth, and makes a good seal and is 3 layers, that's really important. We know about the value of ventilation, and if we know being in a closed space that's small, that's going to put us higher risk, and we can avoid that. There's lots of things I think we've learned, which makes this very different than March of 2020, and I think gives me a lot of optimism that we can get through this much more safely than maybe previous waves have been. We just need to make sure we do those things to make sure we stay safe.
I am guessing that neither three of you have had a chance to really have much of a break. And we've been hearing a lot about staff shortages within the hospital system. Dr. Sutcliffe, how bad are staff shortages?
I think it's a really good question, and this is all relative. So I work in an area that includes the city of Greater Sudbury, but many other really small municipalities with small healthcare systems and limited health human resources. And so it doesn't take much for our small communities to go down and to really feel the impact from a healthcare perspective. So it is the numbers of cases, the numbers of contacts, the staff that need to be off, but it's also our baseline capacity. It does not take much in the north to tip the balance, wherein we are facing challenges in managing acute or serious health situations. Yeah, our hospital is a regional hospital. The numbers of admissions are going up, are increasing. And as we know, this is the case across the province. So it will be very difficult to look to other health centers to assist us in the north. So certainly within our public health system in the north, we're also concerned about the health human resources. We have mission critical right now about getting vaccinations in arms, and we are the lead agency doing that with our public health nurses and other staff. So we're monitoring that very, very carefully and making contingency plans to make sure we can continue to do this critical work within the public health workforce also.
And Dr. Lowe, in your region this past week, you had a code orange, and it's since been declared over. How worried are you that the hospital system won't collapse?
Well, I know our healthcare partners, our hospital partners within the region of Peel have made heroic efforts throughout. I'm sure they will continue to find innovative ways to weather this tremendous storm that's coming through. But it's really important to speak about the idea of staff absenteeisms as a whole and really point to the fact that this does reflect the very difficult transition period that we're going through. We have a highly vaccinated population, but we have a new variant that transmits much more easily and a high absolute number of individuals who remain unvaccinated. And it is that large pool of individuals who remain unvaccinated that are both driving healthcare demand and also driving the isolation policies needed to protect them. That also drives a lot of the absenteeism, not just in the healthcare system, but as Dr. Sutcliffe alluded to as well, even for us in public health units, where we are trying to get vaccinations out as quickly as possible, where our staff have also been on the front lines of this thing for the last 2 years. We're also contending with those same shortages because of the isolation protocols that are in place to protect those who remain unvaccinated at this time.
Vaccine mandates seem to still be something that the government is not, I guess, because it's pushed back and some people don't want to be forced to get a vaccine. And Dr. Hirji, in your region, Niagara Health recently paused its mandatory vaccination policy for staff. How come?
Yeah, so that's actually a decision by our hospital sector that they're pulling back on their mandatory vaccine policy for their staff. Obviously, the province chose not to bring one in place, so our hospital system chose to do it themselves to make sure they maximize patient safety. I think it'd be best to speak to them about what's happening, but I think it is a reflection of just the sheer number of staff illnesses that they have, that they feel that they need to pull on any staff person they can possibly bring into the workforce. But I would really have to defer to them to speak more about this.
But because I think there's a lot of people who are watching this and, they might be vaccinated and might be nervous coming to the hospital because there's a possibility that the person treating them isn't vaccinated. What would you say to those people, Dr. Hirji?
I think we should have some level of concern really anywhere we are around other people, because there's always going to be the risk of infection spreading, which is why we're really all emphasizing in the message here that we should limit our social contacts, really avoid being out of our home unless it's for essential purposes. Obviously, if you need healthcare, you absolutely do need to go to a hospital. You definitely should go. It's important for your health at that point. And our hospitals are taking every precaution that they can. They're going to be wearing good quality personal protective equipment. They are going to be, having high levels of disinfection. They're going to be practicing all the measures to hopefully keep you safe. And so I would say if you need to go to the hospital, absolutely go to the hospital. But in general, of course, you want to avoid being around others because there's never a zero risk scenario.
This conversation around people not being vaccinated is really, I think, multi-layered. There are many reasons why people might not be vaccinated. It could be access, it could be time. I know personally trying to get my own vaccines, I've likened it to the Hunger Games. A lot of people have. And I'm sure it's challenging for people who do want to get vaccinated, but might not have access to get to the vaccine. Dr. Sutcliffe, I wanted to ask this question to all three of you, but I want to start with you. What are some of the challenges have you faced in making vaccines accessible in your communities?
It's a really good question. And from a northern perspective, with the rural remote communities we have, I think that is one of the issues. Certainly, as winter is upon us, traveling the winter roads, our furthest community is at least a 5-hour drive away on a good day. We have challenges in that we don't have economies of scale. So we have to do the same work in providing vaccines, so staff, the transportation issues, the quality control, et cetera, no matter where we are. And sometimes we celebrate, going to all of those efforts and perhaps getting 10 doses in people's arms. So I think that there are issues related to access that, and with the limited health human resources. So trying to make sure we do that. We've worked really closely with area First Nations and urban Indigenous health providers to make sure that there are culturally appropriate and accessible opportunities for members of those communities to be immunized. We have worked really closely with those who are working with underhoused and populations who are homeless to make sure that there are pop-up opportunities and mobile opportunities. All of these are a great amount of effort, but we celebrate really every dose that we get into people's arms. Access absolutely is an issue. Transportation, trying to make sure that even within the city of Greater Sudbury that isn't a barrier, but certainly throughout our districts with the vast geography that we have, to make sure that those opportunities are there for people. So absolutely top of mind about access and about sharing credible, reliable information about vaccine safety and the vaccine effectiveness.
And Dr. Lowe, we know Peel Region at one point didn't have access to vaccines where people wanted to get vaccinated. What are some of the challenges that you have faced in making vaccines accessible in your community?
Yeah, I think this is the fundamental work of local public health, and so you'll hear differences in my answer in respect of Penny's, but this is Dr. Sutcliffe's rather. But this is the essential work of local public health and knowing our community and what we need to get out there. And I would actually respond. We did have access, if anything, in Peel for vaccines for our residents where they needed them through the first and second. With community agencies, our pop-ups were very much focused on specific religious and cultural groups that couldn't attend at mass vaccination sites. Even with our mass vaccination sites, we worked with community ambassadors in our diverse communities to set up booking and transportation links to ensure that people could get vaccinated. Infrastructure is still in play at this point in time. We face obviously a very different challenge right now because 1 million people became eligible for boosters literally overnight with the provincial government decision in mid-December. So we continue to work with our community ambassadors. We continue to work with community agencies, particularly trying to focus on our 50 plus and also our 5 to 11s. But it is about, and it has always been that slog in our community about building trust with different community groups, with diverse community groups that for very good reasons have historic mistrust of institutions, of government, of healthcare, and helping them understand that accessing a vaccination is their best protection while providing that access in the places where they live, work, and play.
Dr. Hirji?
Yeah, Niagara region is probably a bit of a cross between a very large urban area like Peel region and a very remote rural region. I shouldn't say perhaps very remote, but a more remote rural region like Sudbury, where, we have some smaller cities, the largest one, St. Catharines, and maybe 120,000. We have 12 municipalities, some very rural, with under just a few thousand people. And so, like both of them, we're using several of the same strategies, engaging with those, key cultural groups, immigrant groups, to make sure we get access to people who may not have access and may have less trust in the healthcare system or have language barriers and the like. We're also working on having all kinds of pop-up clinics and very localized vaccine opportunities to people who may be living in an area far from a larger center where there would be more access to vaccinations or pharmacies and the like. Then we, of course, have some unique circumstances, such as, we're a big agricultural region. We are, I think, the second or third largest area of Ontario in terms of migrant agricultural workers. And we, of course, want to make sure they're all protected and providing food for us, and, of course, being a part of our community as well. One of the big challenges in terms of delivering vaccination right now is that many of our healthcare partners are very stretched. We've talked about hospitals, and they're very stretched, and so they're not able to play as much of a role in delivering vaccinations right now. And just generally, 2 years into a pandemic, our staff are feeling some burnout. We have seen some attrition of our staff, so we're not as well staffed as we have been in past waves. As well, some of our staff maybe are working part-time for us, part-time in a long-term care home in a hospital. And those hospitals and long-term care homes are in desperate need of staff, and so we're not able to have those staff supporting us as much. And of course, our staff work in the community. They are sadly sometimes contacts of a case of infection, or they have to actually are sick with COVID-19 and have to isolate. And so that makes our staffing very unpredictable. And so that's a challenge that we are grappling with really on a daily basis to figure out how many people do we have that we can bring in the office today? How many doses can we deliver while making sure that we can keep people who might be infectious away from these clinics so we are not infecting people when they come to our clinics. It's a real challenge to actually balance all of that right now.
I can only imagine what the last 2 years have been like for you all in front of the cameras. A lot of people are looking for you for leadership, for guidance, to keep calm in the storm. Before we look forward, can you reflect on the last 2 years and what they've been like for you? I'll start with you, Dr. Sutcliffe.
So it has been a real, honor and privilege to be in this role as we are leading our communities through this pandemic. And I'd like to pick up on something that Dr. Lowe said, and that is the work of local public health. And so I can't just speak about me or public health, but the multiple connections that we have, the network throughout our communities. This could not have been, is not being done alone by any stretch. Public health has a significant leadership role, and I congratulate our public health heroes every day. And it is really through the networks and the relationships that we have established over the years, be it with local municipalities, with police, with school boards, with grocery store owners. We're part in the fabric of this community. And so together we are leading and getting through this pandemic and supporting one another through the very difficult times. I don't think any of us would say that this has been an easy ride. The roller coaster, the drinking from the fire hose, with all of the changes that we've all been experiencing, but that local public health has a responsibility to translate and to make meaningful and actionable in our local community. So it has been a privilege. It's one of those things where I perhaps wouldn't wanted to not have had it because of all the learning and the growth. However, it would sure be great to get a few moments of our lives back, there's no doubt, and with our families that have been supporting us tremendously through all of this.
And Dr. Lowe?
I honestly think the last 2 years have saved a lot of lives and actually made a lot of difference for people who might otherwise have faced mortal or severely disabling outcomes with this novel disease. I think our communities coming together really made a difference in terms of keeping each have been most heartened by how resilient and collective action by our community agencies, all of our community partners, the folks that Dr. Sutcliffe was speaking to, the same exists here with our local public health unit in Peel, has really made a difference in mitigating and reducing the potential impacts of this novel disease. I agree that it hasn't been easy, and certainly there have been many uncharitable or abusive remarks that have come my own way, but I know it comes from a place of fear. And I think the one thing I would leave people with is, even as we look backwards, we know that we've made a difference. We know that we've done the very best we could in Canada, I think, with the context that we were given and the cards that we were dealt. And what we can really need to focus on now in the midst of this Omicron surge is looking forward. What are the things we can do to get through this and to really rebuild as we finish this transition from acute pandemic, hopefully, into something a bit brighter in this year.
And Dr. Hirji, Dr. Lowe mentioned some of the pushback he's received, some of the hate, because you have become public faces. You've had people show up to your home protesting. When you reflect on how the last 2 years have been, how would you describe them?
Yeah, as much as there's been that adversity, and certainly as a member of the community, it's difficult to live through a pandemic. The thing that I really have, cherished about this is the opportunity to work with the incredible people here in our organization in public health. There are so many people who've really stepped up and showed incredible dedication and commitment to supporting our residents. And as Dr. Lowe said, have really literally saved lives here. And as we tried to add additional staff, we hired a lot of really young, new professionals, and they've been really, truly outstanding people. And looking forward, I think as a community, we've also learned a lot about some of the risks in our community. We've learned about the real risks that people who are of racialized backgrounds or more poor backgrounds or marginalized backgrounds have suffered, and how they've disproportionately been impacted by COVID-19 and had less access to vaccinations, as I was talking about a moment ago. And one of the hopes I think we'll hopefully take away from this pandemic is that we've learned from that, and we'll be able to take steps moving forward as a community that, with this greater understanding of these risks, we can hopefully do something to really improve their stock so that we can actually make a more equitable society going forward, and a society that's more resilient to any future health threats that come forward. And I hope we make reinvestments across our health sector, our social sector, and public health to make sure that we can achieve that.
I want to thank all three of you on behalf of all Ontarians for working so hard to keep our communities safe. Dr. Lowe actually just came from a press conference to make it for this interview. We really do appreciate all the hard work that you've been doing. And hopefully in those moments, maybe a few hours, you get an hour and a half to yourselves. We really do appreciate your insights tonight. Thank you so much.
Thank you so
Thanks,
much,
and all the best for 2022.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.